Excessive thoracic kyphosis may be the result of poor postural positioning, but if it's greater than 40 degrees and cannot be passively reduced, then it's considered a structural hyperkyphosis. This can be caused by previous stress fractures, osteoporosis, or Scheuermann's disease. But let's take a look at some posture and exercise considerations for this population. Here are 3 images of spinal balance. On the left is a spine with optimal sagittal balance as the posture line falls from the tragus of the ear to mid-shoulder to greater trochanter and the lateral ankle. The second image is of a spine with positive sagittal balance, which means that a line drawn now from C7 falls more than 4 centimeters in front of the sacral base on an X-ray. This is represented by a forward head posture with hyperextension in the upper cervicals, flexion in the lower cervicals, increased thoracic flexion, thoracolumbar hypermobility, and loss of lumbar lordosis. The final image shows a compensatory posture for positive sagittal balance, called negative sagittal balance, where the line now falls posterior to the sacral base. The pelvis sways forward and it tilts more posteriorly. Here's a closer look at the forward head posture with upper cervical hyperextension and lower cervical flexion. The goal is to reduce the upper cervical hyperextension, perhaps by imagining holding onto a small ball or orange between the chin and the sternum, while simultaneously bringing the head back, thus extending the lower cervicals. One stretch that is often recommended to mobilize the thoracic spine is arching over the back of a chair. But in hyperkyphosis, due to the thoracic stiffness, only the already hypermobile areas will move. They are areas of give, including the thoracolumbar junction, which causes the ribs to flare, and the upper cervicals. Better to think relative extension or elongating the spine by adding gentle pressure to the back of the head with the hands while holding that imaginary orange to reduce upper cervical extension. Control of rib flare requires use of the abdominal muscles. And then this provides an extension moment in the thoracic spine where there may be no movement into extension, but the extensors are working to reduce the flexion force of the kyphosis. And the deep cervical and trunk flexors are engaged to prevent hypermobilizing the gives. This prone spine extension exercise, the DART, is great to activate the extensor muscles. But when someone with thoracic stiffness and hyperkyphosis tries to perform this exercise, the give in the upper cervicals and thoracolumbar junction will again promote hyperextension. Better again to think relative extension by imagining that orange between the chin and the sternum to engage the deep neck flexors. And this continues to extend the lower cervicals, which will limit how high the head comes and will reduce the thoracolumbar hyperextension. Engaging the thoracic extensors reduces the flexion force again on the thoracic spine. Remember to control the gives when trying to reduce the stiffness in someone with hyperkyphosis.